So you want to go first, Austin? I think you and I are the only ones with agendas.
No, I'm good. Or if you want to go first, Bob, either one.
Okay. Are we all online? I can't see everybody.
Yeah, I believe everybody's here, what I can tell.
Everyone is here, but whoever opens the meeting first, do a roll call for the record. And don't forget to do your disclaimer that the meeting is electronic because of COVID.
Okay. I'll do it. I think I can see everybody. Austin James.
Here.
Brad Johnson.
Here.
Robin McCamey.
Here.
Ginger Holdren.
Here.
Ray Lyons.
Here.
Randall Jenkins.
Here.
Who else am I forgetting here? I'm here.
Amy.
Mike Hill here.
Oh my! Sorry, your picture disappeared. Okay, we have a quorum. Everybody's present and accounted for. The disclaimer is that because of COVID-19, we are all meeting remotely. None of us are in the same room together. So, and we do have the county attorney on the call as well, so he can advise us of where we can go and where we can't. We also thank Abby Fry, the executive assistant to the mayor, for being the moderator and handling all of the agenda items that will be flashed before the screen. So everybody has been distributed an agenda. So do I have a motion to approve?
Motion to approve, sir.
Okay, Mike Hill makes the motion. Is there a second?
Second.
I'll second.
Okay, I didn't saw Randall Jenkins, so I'll take you as the second. All in favor, aye. Any opposed? Okay, it's unanimous. I presume we have no public on the line, but I'll ask for public comment in case someone is listening in or wants to raise a hand and comment. Okay, hearing
The
none.
only non-committee member in here is me, the mayor, Gwen from the clerk's office to do the minutes, and we also have Commissioner Tester with us.
Oh, okay, great. Welcome to all of you. Thanks for being on the call with us. So hearing no public comment, we move to item 4, which is the approval of the minutes from February 4th, 2020 meeting, and those have been distributed.
So moved.
Okay, Commissioner Hill makes the motion. Is there a second?
Second.
Second by Commissioner McCamey. Any discussion of the minutes? Okay, hearing none. All in favor, aye.
Aye.
Any opposed, same. Okay, it is unanimous. There are 2 items which I thought I had put on the agenda, but the copy I have doesn't show them. One is the issue revolving around the health department accepting the contract, their budget. So that we'll need to look at those. I distributed that earlier, and we'll take them up a little bit later in the meeting. But what I want us to discuss first is a resolution regarding the purchase of health insurance from the county by commissioners. Each of you were distributed that resolution. Thank you, Attorney Harden, for providing that. Basically, as a summary, it will allow, if it passes the full commission, for county commissioners, their dependents, their spouse, to purchase the county health insurance that we are currently engaged with, along with dental and vision insurance, but it must be at their expense. Let us make sure we underscore that there is no county funds to be expended as a part of this benefit going to commissioners. The commissioner, he or she, can say, yes, I'd like the insurance, I will pay for it. and whatever the premiums are, if they include themselves, their spouse, and their dependents, can take advantage of that insurance. The other thing that it provides is that if after one term of serving the county commission and the commissioner seeks to not be reelected or is not reelected, they have the opportunity to exercise with the county to purchase that insurance for themselves, their dependent, and or their spouse. If that commissioner predeceases any member of his family that's on the policy, the spouse has the opportunity to exercise a right to, again, pay whatever the premium is going forward to be covered under that insurance. Josh, I think I've covered everything. Any words of wisdom or comments that you'd like to make?
The only thing I would say is that you didn't specifically read there was if the commissioner retires or is not reelected or doesn't seek reelection, they can only maintain the coverage if they had already gotten the coverage while they were a commissioner. So just former commissioners couldn't just come out of the blue and get it later.
Right.
It could just continue on after they've already served if they got it while they were serving.
Yeah. Thank you for that correction. I don't have the entire resolution before me. Thank you for that comment. We'll open it up for discussion. I guess in the proper Robert's rules, is there a motion to accept this resolution?
Motion
Chairman, I'd
to
like
accept.
to move that we adopt as presented.
Okay. Is there a second?
Second.
Second by Commissioner James. Commissioner Hill made the motion. Okay, we open the floor to discussion. Any discussion?
Mr. Chairman.
I'll go. Well, go ahead, Mr. Johnson.
Mr. Chair, how does that, and does it affect the services of our broker? Have they been queued in? Have they looked it over that they can represent it since they represent the county?
Good question. I did reach out to Kelly Gear, who is a member of our broker team, the Sequoia Group. Kelly provided us not only with a resolution passed by Maury County, but she looked at our resolution and said that everything looks in order and they would be happy to offer that service to anyone that wanted to come under the county umbrella for health insurance, dental, or vision.
Thank you, sir.
Thank you.
Chairman, I don't see a downside to this. I think that the insurance game, as we learned during the study, is a numbers game, and our goal is to increase the pool of insured as make it as large as we can. We may not have any people that take us up on it, but it would be a nice it's a nice segue into perhaps expanding the pool by involving hopefully someday the school system or maybe the city, like they indicated at the round table that they might be interested in pursuing with us.
Any other discussion on the resolution?
I think it's a really great way to start being, we're going to have to start coming up with ideas to incentivize commissioners as much, I mean, it's good to help the county out and do it, but at the same point in time, we're fortunate and blessed to have the people that we have in there, but we have a lot that I'm afraid that will leave us this next term, and it's going to get harder and harder and harder to get people just about pretty well volunteer their time to do this. So there's going to have to be some incentives behind it, and this is a good incentive to probably offer a cheaper cost burden on them for their health insurance while not costing the county anything to do it.
Yeah.
So.
Well, whoever would take us up on this theoretically would be paying the county. It would reverse the flow of dollars. That $50 would go toward maybe the overall cost of the insurance.
Exactly.
Attorney Harden, do you see any issue with us beginning this if it's passed by commission this month on this insurance cycle? The one that's coming up?
Right, I wouldn't see an issue with it as long as the broker would have time to implement it with whatever they have to do when they get bids or see whatever our costs are going to be. It probably wouldn't be very many additional people added to it. And the only potential downside that I could envision whatsoever is if, whomever joined, had some sort of huge claim that came with them or some ongoing costs that ran up our claims total. But of course, we can't, pick and choose and discriminate on that basis.
Right. Any other discussion? Thank you for those caveats. Hearing none, because this is a resolution, I think we need to take a roll call vote. I can either call the roll, or Gwen, if you'd like to call, you certainly are the ones that keep in the minutes.
Austin James,
Aye.
Brad Johnson, Brad Johnson,
There he is.
Mike Hill,
Aye.
Randall Jenkins,
Aye.
Robin McCamey,
Aye.
Ginger Holdren,
Yes.
Robert Acuff,
Aye.
Ray Lyons.
Aye.
Aye. Thank you all. That is unanimous, and it will go forward to the commission at its meeting this month. Item number 6. As many of you probably have heard, or if you haven't, Monty Taylor called me a week ago or so, and I know that he had spoken with Attorney Harden about the use of smokeless tobacco within the courthouse. Apparently, he had received complaints from a number of citizens who have come into the courthouse, particularly to his office, and they
Dr. Acuff,
had, pardon?
I think the other 2 resolutions were on the agenda before that.
Oh, okay, sorry. Thanks for doing that. Thanks for,
Grant.
okay. I know I printed off the wrong one. I guess the other 2 resolutions involve the health department. One is to renew their contract, and the other one is to also approve their budget. Is that not correct, Attorney? Pardon?
No, the next one on the list was the litter grant.
Oh, sorry.
And then the health department grant contract.
Okay, sorry about that. I need to reprint the agenda for myself. So yeah, the litter grant has to be approved. It's in the form of a resolution.
Motion to approve is accept as written.
Okay, there is a motion by Commissioner Hill to approve. Is there a second?
I'll second.
Okay, who was that? Was it?
It was Ginger.
Okay, thank you, Commissioner Holdren. Any discussion on the litter grant resolution?
I would say, Dr. Acuff, I know we're advancing it on to the full commission. The actual application that I saw is actually due, I think, a couple of days before our commission meeting. And they said, whatever, I guess because of the COVID-19 situation this year, the resolution really isn't even required this year. We're going to do it anyway. But usually the attachments that go with it, the proposed use of the grant, I think Captain Smith from the Sheriff's Department usually puts that together, because usually this all goes through the Sheriff's Department.
Okay, thank you. If there are no further questions, then Gwen, if you'd like to call the roll to approve the resolution for the litter grant.
Austin James,
Yes.
Brad Johnson, Brad Johnson,
yes,
Mike Hill,
Aye.
Randall Jenkins,
Aye.
Robin McCamey,
Aye.
Ginger Holdren,
Aye.
Robert Acuff,
Aye.
Ray Lyons.
Aye.
Okay, thank you. The resolution passes unanimously. And correct me, Attorney Hardin, but I think the next one is the Health Department contract resolution.
Yes, sir. It's to approve the state grant that they get every year essentially. But because the last resolution says the mayor is only authorized to sign just simply renewals or extensions. This is a couple of the terms are a little bit different, so we have to reapprove it again, but it's obviously just money from the state for local public health at the health department.
Okay.
Motion to approve.
Okay. Commissioner Hill makes the motion. Is there a second?
Second.
Okay.
Aye.
Okay, thank you, Commissioner Lyons.
Mhm.
Any discussion about this resolution or questions? Okay, hearing none. Gwen, please call the roll.
Austin James,
Yes.
Brad Johnson,
Yes.
Mike Hill,
Aye.
Randall Jenkins,
Aye.
Robin McCamey,
Aye.
Ginger Holdren,
Yeah.
Robert Acuff,
Aye.
Ray Lyons.
Aye.
Okay, it is unanimous. Thank you all. The next item also involves the health department. As Abby brings it up there, it is their grant contract that we must approve and must pass the full commission. I think you can see the total contract amount of $590,588.
Need your computer.
And so is there a motion to accept?
So move.
Second.
Okay. So any discussion or questions about this particular item? Hearing none. Gwen, please call the roll.
Austin James,
Yes.
Brad Johnson,
Yes.
Mike Hill,
Aye.
Randall Jenkins,
Aye.
Robin McCamey,
Aye.
Ginger Holdren. Can you repeat your votes, please?
Yes.
Robert Acuff,
Yes.
Ray Lyons.
Aye.
Thank you.
Thank you. It's unanimous. Now to smokeless tobacco products. And Josh, you may want to weigh in on this since I think Ronnie Taylor contacted you first before he did me. But as I said earlier, Mr. Taylor was contacted by several of our county citizens who had visited his office and then he received some complaints about employees using smokeless tobacco products in his office. He took action, and now he has a policy that no individuals who are employees in his office can use smokeless tobacco in the office or in vehicles that the county owns. I believe that's the way it is stated in his rule for his office. I think the discussion that I had with both Ronnie and with the attorney indicates I don't think we can have tell elected officials how to run their offices, but we certainly can establish policies for the county. I'm also concerned, as I've talked with folks within the courthouse in some of using our restroom facilities, or individuals who come into the courthouse who are citizens who are using smokeless tobacco, and many times either spit in the hallway, spit in a sink, or in the water fountain, or in other areas that, since we're taking personal hygiene to its max during COVID and beyond, we needed to have a discussion on how the commission feels, or at least health and welfare feels, about the use of smokeless tobacco in the courthouse in general, but also from constituents entering in to do business there, as well as use of that same product in vehicles that are owned by the county. Attorney Harden, you want to weigh in on that discussion with Mr. Taylor and your thoughts?
Sure. I do think that the county commission can adopt a policy that applies countywide. It's like our employee handbook now has, the no smoking provisions in it. That doesn't extend to smokeless tobacco, but we certainly can adopt a countywide policy, employee handbook, that says no smokeless tobacco on the county while you're at work, on county property and county vehicle during working hours. That's what we can control as a policy. The individual office holders can opt out of the general policies and institute their own office policies. I don't know if anyone would want to do that, for this issue. But at the end of the day, I mean, it's a health issue, and certainly we can, the commission can control within county property and in county vehicles whether or not that can be used.
Chairman, should we just adopt a tobacco-free campus type policy for the whole thing then? Tobacco-free?
Right. I think that's how the discussion should lead us. Do we want to adopt a total tobacco-free environment for all of the county buildings and vehicles? And the use of smokeless tobacco, even though we do have a no smoking sign outside the courthouse, we wouldn't expect somebody to be smoking in the courthouse. So I would hope if we implement this, that we would also prohibit individuals coming in to visit in offices or do county business, that they would not come in with a smokeless tobacco or using smokeless tobacco products.
So,
Sure.
question for the attorney?
Sure.
Sorry, this is awkward. Sorry. So the individual office holders could opt out. The elected officials could opt out.
I don't think they can if it's a general policy for the whole county within our buildings, within our county, but it's not really, we're not controlling the employment aspects in the office. We're not dictating the control of the employees within the office. We're saying if you're in the county building or a county-owned vehicle, that you can't use the tobacco products, and I think the commission can do that. The current state law, Non-Smoker Protection Act, I think it is, prevents the smoking already within all public buildings like our government buildings. So that's not really an option we have anyway, but it extends to vaping, my understanding of it, but it wouldn't extend to smokeless tobacco. So I think that the commission can vote to go that step further and make it smokeless tobacco as well. Ironically, our current employee policy still says employees can smoke in county-owned vehicles if they're in there by themselves. It's only if they're in there with someone else that they can't smoke. So I don't know how much sense that makes, but we may have some folks that smoke and people like sheriff's deputies who spend a lot of time in a vehicle, so you may want to consider those things.
Commissioner Johnson, I think you had a comment?
Well, mine more or less, it may be our county attorney has covered it. It's always nice to come up with some real sweet rules. You come up with a county policy that says, who is the enforcement? You have no enforcement, why adopt the rule? Just to hear your own voice. Secondly, he brought the point up, just like law enforcement. county vehicle, somebody needs to give a definition. Is it a county vehicle that only courthouse employees use? Because you have law officers out there that have county equipment. You have fire departments that have the same. I think it's a little unjust. And if you have signs, no smoke, as a point, smoking around the courthouse, who's the enforcer? It's not law enforcement. According to the Tennessee Code, and I believe you can correct me there, Mr. Attorney, that the health department is the one that has the enforcement on it. So where is they don't even have an enforcement officer. So where's the rule?
Yeah, as with any rule or law, it's only as good as the enforcement. I agree with that. But within our employee handbook specifically, the enforcement is with the office holder, with the supervisor of these employees, so that for using tobacco and you're not supposed to, they can be reprimanded. Verbal reprimand, written reprimand, all the way up to being fired for repeated violations. It's a rule just like any of the other work conduct rules that we have.
Well, what become of the rule that we pass for all or none instead of just select group? Because that's kind of restrictive and discriminatory, don't you think?
Right. Yeah, I agree with that. Yeah, it needs to be all or none, and that's what I was saying. I mean, I don't know how far you want to extend it, and people like sheriff's deputies who are in the car, 12 hours or whatever. That's a lot different than somebody who might, just be in the car for 30 minutes a day or an hour a day. So, if you're going to adopt it, it should be applied equally. At the end of the day, like I said, if there's specific policies that affect the employment within each office, if the office holder decides to, they can opt out and adopt their own policies. But I don't think that extends to whether or not they're allowed to smoke in the car or in the buildings, because the office holder doesn't own those things. The county does. So I think it can be done. It's just that you are going to consider how broad you want that policy to be and how far you want to extend it. With Mr. Taylor, the conversation I had with him, the concern was just the smokeless tobacco, cans and bottles and spittoons sitting around the office. That was his concern. I don't think it extended to vehicles or anything like that.
I have fielded some concerns about the school administrative offices that I told them wasn't really a county issue so much as a school issue. We got some smokers on the committee, right? I think we've heard from Mr. Johnson. Randall, I hate to single you out, but what do you think?
Well, I mean, I haven't smoked in quite some time, but
Congratulations.
Coming from a smoker, or I think we're overreaching a little bit. And again, to go back and touch on what Mr. Johnson says, who's going to enforce this? Of course, I mean, you can't smoke in the building. We can control that. I don't know. I mean, there's not many places. The hospital, you can't smoke on the property there. You can't smoke on the property at ETSU. There's other places. I don't know. It's just how far do we want to take this? How far do we want to reach? I've always been one for the government to not reach so far, but I mean, it's our property that we're talking about. So doesn't help out much.
We did turn down a simple request for playgrounds a few months ago.
Yeah. Well, I think my main concern, I think I certainly agree with Attorney Harden and much of the discussion that it may best be the elected official or supervisor's choice as to what their employees do and what health habits they bring to work. But I would like to protect our employees from the spittle, if you will, from smokeless tobacco users doing business in the courthouse. As I said, we have found it in sinks and water fountains, in trash cans, in cups that people bring in. I think that's a health hazard. and I think we should treat it as such. And I would appreciate us protecting our employees by not allowing our constituents to come into the courthouse to do business using smokeless tobacco products.
But how do we know that it's
I
not
think that would be a fair
constituents?
ask.
Well, I guess since we're going to have one point of entry and a guard there who is supposed to take temperature, I guess they could say, open your mouth and say, "Ah."
Out with you. Yeah. I mean, it would basically come down to just posting signs at the courthouse. Then is what it sounds like to me. We're talking about. We already prohibit smoking in the courthouse. We could just simply change the word to no tobacco or tobacco free. It's a tobacco free courthouse, and that would pretty much achieve that objective without extending to the vehicles or the employees. That's up to their bosses, don't you think? If our goal is to limit the amount of exposure from the public coming in and dipping and leaving the bottle, the cup, whatever, laying around the courthouse, then that would probably go a long way to fixing that problem. Just posting a sign and prohibiting the public from using tobacco on premise.
Yeah.
And then leaving it up to the office holders other than that? Is that what you're saying, Mike?
Well, that's what our attorney pretty much told us. Whatever we passed, the office holder would do as they bloody well please, whether they agree to it or not. You know, they would choose for themselves. So if the issue is members of the public coming in to do business at the courthouse, you know, that's only one specific building. We could certainly turn that into a tobacco-free campus. Just slight adjustment and let the office holders still control their individual domains with the employees.
Any other thoughts before we entertain a motion, if there is one?
I would put that in the form of a motion to turn the courthouse into a tobacco-free campus and post signs accordingly at whatever entrances the public would use.
Is there a second?
I'll second.
Okay, Commissioner Holdren seconds it. Further discussion?
So, Mike, are you saying it's tobacco free to the public and not the employees, or what?
Well, we have no control over the office holders who operate within autonomy, as I've been told on several of the committees that I've chaired over the years. But Mr. Taylor's issue seems to be more with the folks that are coming into his office with a chew and then leaving the cuspidor, you know, laying around for them to clean up, as I understand the conversation that is developed here. So I wouldn't put anything public, private, employee, anything. I would just simply put Carter County Courthouse as a tobacco-free campus, and then the office holders can privately have conversations with their employees as to whether they will comply or not. But it would certainly keep them from having to pick up after folks that are less than courteous and would presume to leave the Dr. Enough bottle full of tobacco spit on the counter after they registered their deeds or such.
Okay.
Chairman, can you hear me?
Okay, any other discussion, any other thoughts?
Mr. Chairman, can you hear me?
The mayor's trying to say
Oh,
something.
go Mayor, speak up.
I don't know if I've got my mic up to mouth, but can you hear me?
Yes.
The conversation I had with Mr. Taylor was his employees at the time. So
Correct.
And so he corrected, he said he took care of that, but he wanted something in black and white. So the problem was with his employees when he spoke with me.
Okay. Thank you, Mayor.
Yeah, I mean, I personally feel if we're going to make it tobacco free, then it's tobacco free to everyone. I mean, I get that in some essence we can't control the office holders' employees, but let's not forget the courthouses. The building itself is under the complete control of the mayor.
Yeah. So, Mayor, how do you feel if we were to institute that as a rule, if you will, adding the not only no smoking, but a tobacco free entity?
I totally agree. Tobacco free, yes.
Okay.
Smokeless, I guess that would cover everything, wouldn't it, Mr. Harden?
Yeah,
Tobacco free? Yeah.
it would. I mean, you could, I guess, I don't know if that vaping stuff is technically tobacco or not, but I mean, that's a form of smoking. So in my view, the current state law covers that anyway. But yeah, I mean, it's strictly tobacco free. You can post, vaping or snorting or whatever other form you do with that stuff.
Yeah. Yeah. Any other discussion?
I just want to clarify if it's the building only or the perimeter of the building. Because if they stand right there at the door, the smoke wafts in.
I can't make out what she said.
She's saying is it just the
About the
building itself, or does it mean surrounding parking lot and property?
Well, the tobacco smoking extends to the property. You can only smoke in your actual vehicle. But, I don't know how you're going to, if somebody spits it out while they're walking in. Obviously it's all about enforcement and if there's going to be any, but
Right.
over at the annex, I mean, I've seen them kick people out of the courtroom for chewing gum. So surely someone can see if someone's, in there dipping and ask them to leave and they'll get, move their dip.
Any other questions or discussion?
Attorney Harden, after they pay their taxes, we'll kick them out.
Well, that and too, just to give them instructions for those that want to enforce is, kind of stand with a Weaver stance with your hands on your hip and stomp your foot 3 times and tell them don't be doing that. That's about as good as you're going to get.
It's 2 warnings and then double tap. No, I'm just
Either that or 50 laps around your local telephone pole. What a waste of time. Gosh, I'm not.
I say we ask Chairman Johnson to come police this for us.
Yes, I would. Matter of fact, I would be guilty out in the parking lot. I'd be like an old veteran at the cafeteria said when they passed the rule of iron. He lit up in front of them and said, "Now, who has the lower fortitude to reach for this cigarette?" Matter of fact, he finished the cigarette. You will know what happened. So there was a lot of science wasted. They wore the subject out. Federal law came down to where, even on places where I was at, we had to build exterior shelters for those who want to use tobacco products and take their breaks and all. Of course, I don't know what went with that rule later on, but they found out that later on also they found out that employees deserve to take a break of such as that if that is their habit. So what become of those rules? Now we got he's got something black in his mouth. Well, good gosh, thank you. I hadn't seen that line yet. Have you all? Oh, that's what I thought.
Well, I do know on the, and you probably do now as well, on the VA grounds, they have prohibited all tobacco use. In fact, when I come and go to the station, I see employees outside the gate smoking.
Yes, that's true.
Yeah. So there's a motion on the floor to add a tobacco-free sign, at least for the courthouse. If there's no further discussion, Gwen, do you mind calling the roll on this?
Austin James,
Yes.
Brad Johnson,
Yes.
Mike Hill,
Aye.
Randall Jenkins,
No.
Robin McCamey,
Aye.
Ginger Holdren,
Yes.
excuse me,
Yes.
thank you. Robert Acuff,
Aye.
Ray Lyons.
Aye.
Okay. Motion passes 7 ayes, 1 nay. So thank you. We'll go on. Just as a couple of updates here. You should have gotten an email from me in terms of rescheduling our homeless Zoom event. with Bert Rosen, President and CEO of CARM. That will be Thursday, May 21st, 2020. We've reserved from 4 to 7, but we will not go that long. I think we will not start until 5 for those of you that want to join us. There is joint interest by County Commission, City Council, a number of churches, a number of nonprofits like the Girls and Boys Club, and others that want to come on and listen and ask questions. So I presume that Bert will be with us probably for an hour and a half, maybe at the most. Abby, I'd ask you a question in terms of, are we limited to how many people we can have on the call? And obviously the public would need to be given the access to listen in. And is there a time limit? As I said, I don't expect us to go more than an hour and a half, but we would use Zoom. So I want to make sure we meet all of their rules and can accommodate the people that want to join us.
As far as I know, there is no limit with our Zoom account because of the paid subscription we did, because Attorney Hart and I had discussed the public access and making sure we had enough slots, because if we had 50 and that 51st person tried to get in and they couldn't, that would be an issue. As far as time limit, I've not encountered that yet, and we did have a 5-hour budget hearing last night, so we know it goes at least that long.
That's right.
Okay. Well, everybody will receive a reminder, and Abby, I'm assuming that we can use the same address for this month that we all joined this Zoom meeting under?
Yes, with our paid subscription that we did through Zoom, we set up a permanent meeting link.
Okay.
So any of the meetings that we host for the county will be accessed with that same telephone number, the same meeting ID, and the same web link.
Great. Thank you. Thank you very much for doing that. Just an interested factoid on the opioid use and epidemic. I just received some information across my desk last week, I guess it was, that talked about the issue of the opioid epidemic in the current time that we find ourselves. And I think the CDC and maybe a couple of the other drug entities that are out there that monitor this sort of thing, that every 1% loss in job, we have a 3.6% increase in opioid overdose. So I just thought I'd throw that out there to you, and with people in our community who are losing jobs or have been furloughed, their incidence of overdose potentially could increase. In terms of food accessibility, I just got off of a call with Boys and Girls Club. We're looking at reopening and how we would do that if we were to reopen. I do know that in terms of food accessibility, the county schools will be using their nutrition program through the month of June. And we still have, if any of you have been to distribute meals at any of the schools that are doing that on during the week, you noticed probably a lot of hungry kids. I know the mayor was out at one and commented to me on just the kids as picking up their sandwich and then getting their milk in between the door to pick up your sandwich and drink your milk. In the next door, they'd already consumed their sandwich, grabbed their milk and downed it. So obviously we have a real need, and Boys and Girls Club are trying to address how we can do that. I've talked with Brandon Young at Harmony Baptist. They're going to be on not only on the homeless call, but they're also worried about that. And I think, as listening to Commissioner Hill in a conversation that we had earlier today, Harmony Baptist has talked with Joe and Sonia Miller, as you all know, who own Bob's Dairyland, and apparently they're coming alongside and helping them feed some of the kids out there that need meals, and families too. So that gives you kind of an update. Again, you will receive from me a Zoom invitation for the event on Thursday, May 21st with Bert Rosen. If there are no questions, any new business to come before us?
Chairman Acuff,
Yes.
I just wanted to share this with the committee. It's some statistics that I uncovered last week while working with the school system for some Perkins grant information. And it pertains to our homeless and our food accessibility. The current poverty rate statistic for Carter County is 24.5% of our residents live at or below federal poverty level. There's another statistic they're adding into this now called ALICE, which stands for Asset Limited Income Constrained Employed. So these are families that they are working, they are above federal poverty limit, so they do not qualify for a lot of assistance programs, but their income is such that it is below the cost of living for our area based on the average price of things like rent, childcare, utilities, and those things. Our ALICE number for Carter County is 25%.
Wow.
So if you add that to our poverty level, that puts us at 49.5% of our county residents who are living below the cost of living for the county.
Oh, man.
Staggering.
Yes, I agree, Commissioner Lyons. That is staggering. So, Abby, can you provide us with or provide me, and I'm happy to distribute it to not only our health and welfare group, but also make sure that Bert Rosen has a copy of that as he comes before us at the end of the month to talk. I think those are damning statistics, really heart-wrenching for me to hear that. And I think, but in having said that, I think we need to get the level of awareness, we need to raise it for folks in the community to recognize we got a problem.
I'll be glad to share that with you. I actually have a copy of the statewide ALICE report, and it breaks it down for the statewide numbers, and then each county has a report that lists its average costs and things and what people are struggling with. And one of the biggest struggle areas for our community, according to that report, is affordable childcare.
Yes. Right, and that's earlier today I met online with other board members of Boys and Girls Club across the state of Tennessee, and they're all lamenting that same thing. There's not enough childcare out there, and as parents and foster parents begin to go back to work, what do they do with their kids? That's going to become a real issue that we're going to need to address. And I'm not too sure that our Boys and Girls Club can pick up that slack. We're going to try to work hard at that, but hopefully we can come up with a plan that might be emulated by others in our community to open their doors to help that. Of course, it goes without saying that comes with risk to individuals who are running those facilities or staff and kids that are involved. So, but childcare is a big issue, not only in the state of Tennessee, but nationwide. And by the way, just as an editorial piece, the CDC has yet to give any direction on what those facilities should be doing, because as we all know, kids are probably not going to wear masks. They certainly aren't going to social distance. And there's just a lot of other inherent problems when you bring kids together, although it's a blessing when they do come together. Thanks for bringing that forward, Abby. I really appreciate that input. Old business. Yes, sir, Commissioner Johnson.
Could you, with the facts and the figures that Ms. Abby has provided us, what is wrong with the mindset of our office holders, directors, and all of our services when they're submitting their budget requests? When you look at numbers like this and what this nation is going through, where is their mindset? Yeah. I mean, that's a mental health thing, which comes under health and welfare. I worry for them.
Thank you. I do too. I think it's a real issue. And in fact, we know, I've talked with a number of the mental health professionals, and Commissioner Lyons, I know you're tuned into that stream as well. Many of them say that we've got problems that we don't even know about out there, and that they're seeing more issues now that everybody has decided to stay at home with mental health issues for kids, as well as abuse and other things that go along with sheltering at home. That should concern us all.
Yeah, I mean, you sit there and listen to the budget presentations, and you add up every organization that provides meals during the year. And then you couple that with the amount of meals that our school system provided during this time of pandemic. When you add them up and divide them by our population, we don't need any stoves in the house. We got to figure out who's getting all that food, because our children are scrawny, but our adults are getting fat.
Amen. Well, and I do know that Angie Odom at TLC is also they're continuing their program. They're asking for volunteers as we speak. And as you all know, I think she did like 87,000 meals last year, or some magnitude thereof. So we got a problem.
Chairman. Yeah. Can I throw a couple things in to the
Yes,
the
sir.
chatter? Yeah, okay. So if you remember back when we were meeting with Harmony Baptist and the Boys and Girls Club and trying to put that satellite campus together, I pointed out then that there really is a child care, especially after school child care problem in Carter County. An exacerbating factor to that is the Carter Cares program that the schools put on prices private enterprises completely out of the market. There is nothing in District 2 other than private individuals who will watch kids for a fee. We've had a couple to try to establish and then fold because they can't compete with the subsidized $40 a year that Carter Cares puts on, which is fine as long as Carter Cares is funded and operational. However, Carter Cares lives and dies off of a grant cycle, which comes back to Commissioner Johnson's point. The budgets that are being presented in the 4 or 5 years that I've been aware of this problem have not proposed bridge funding to pick up the slack between the ending of one LEAP or Century 21 grant, 21st century, excuse me, and the beginning of the next, because every 3 years, I believe it's a 3-year cycle, Carter Cares, the big announcement comes around that parents are going to have to just do something else until their funding is renewed, and there's a gap. So the existence of that program creates a situation where private enterprise can't fill the gap, and the county and the school budgets don't put up any bridge funding to smooth out the roller coaster ride. And I've had, you can set your watch by it. Every cycle, I get calls from parents like, what am I going to do? I'm going to lose my job trying to go get my kid at 3 o'clock because I work in Johnson City. I work in North Carolina, et cetera, et cetera. So, there's more to this than just the feeding program. And I don't know what the solution is because, bridge funding does require an allocation.
No. Good points. Good points.
Mr. Chairman,
Yes, sir.
back on the homeless, Miss Ann Cooper with the Appalachian Regional Coalition of Homeless, she wanted to be involved maybe in that.
Right.
The Zoom call, I've been working close with her to help out with the Shepherd's Inn up here. They've helped them out a whole lot of Shepherd's Inn.
Yeah.
So, and then
Now,
the Army has too. So
Yeah.
she wouldn't be involved with having.
Yeah, I did. Thank you, Mayor. I did reach out to Ann Cooper, and she is going to join us on that call. So she's been included.
Thanks.
Old business? Well, hearing none, thank you all for being online and all the discussion, and hopefully we can move ahead. I'll ask for a vote of adjournment. Is there a motion?
So moved.
Okay, I think I heard a
I'll
first and a
second
second in there. So all in favor, aye? We are adjourned, Health and Welfare.
May I move that we take a 5-minute break?
Yes, sir. 5 minutes, folks.